right, a couple more coming to join us. So if you're just joining us today, thank you so much for being here with us on our first webinar. We're super excited here at the Wellness Clinic this morning. We're doing our premiere webinar, and Dr. Maria will be with us here in a moment. We'll get started, and Kat and I are here moderating. Kat's our tech moderator. She'll be helping with the questions. Be familiar with that chat box. We're going to be using it throughout the webinar. I think that's it so far. All right. Well, welcome everyone. It is 10 o'clock. Maybe I'll wait till 10:01 to make sure we get everybody in here. Hope you're comfy someplace, sitting where you can hear us well and your signal is strong. And I'm just so grateful to be doing this. I've been wanting to do this for 10 years, and of course it took me working with Dr. Maria to actually have it happen. I know that Dr. Maria has been working on it herself for quite a long time, and it's been a goal, and so we're so excited to have this benchmark in our mission to bring you the best health information we can do that through. So without further ado, let's go ahead and get started. So I'd like to have you check your lighting and your connection and your volume, and then get yourself familiar with the chat box on the right side of your screen. And also remember the checklist. These are all pieces to help you get the most out of our time together. The checklist came in your registration email. And I think I'll go ahead and get started. Let's go ahead. Dr. Maria is a postural neurologist. She's a functional medicine practitioner. She is a chiropractor extraordinaire and has been in practice for almost 30 years, something like that, maybe over 30 years. Is that right, doctor?
29.
29 years.
30,
and then
it'll be 30 in July.
Yeah, 30 works. 30 works. You were practicing before you actually opened your practice, yes. Right? So in any case, yes, and I'm so excited here today. I know you are too, and you have great information to bring us. And I know that in your deepest heart is the same as in my deepest heart, and you too, Kat, is the wellness and the well-being of our tribe. And our tribe is us in this room, it's our families, it's our community, and it's our world. And our universe, maybe, right? So without further ado, Dr. Maria Maricic.
Yay! Thank you so much, Cynthia. And welcome everybody to our webinar today. I so appreciate you taking time out of your day today to join us, and you're going to be glad you did, because this is really valuable information. It's something you haven't heard before, I promise. And if you choose, it will change your life. It's really good stuff. So let's get right on to the slideshow. Let's see here. Let's switch back over to that. Okay. So as Cynthia said, I'm a chiropractor, doctor of chiropractic. My specialty is functional medicine and functional neurology. And today, of course, we're talking about menopause and menopause madness and how to address that, how to stop the craziness. So basically, when estrogen drops, it causes a whole barrage of things. So all hell breaks loose when estrogen drops. My personal goal and passion and mission in life and in my practice has been to help people optimize their health and their well-being, to uplift people through health, body, mind, and spirit. And this particular topic I've worked with for many years, but it became much more important to me because I'm in those years. And I'm going through some changes myself, but I really understand menopause better now that I'm in that. And I also have had some experiences where I notice people treat me differently. And so I was like, wow, this is just interesting. I've never felt invisible. I don't feel invisible in this community, but when I go outside of this community, I feel a little bit invisible. So my passion and my mission is to help us as a tribe be empowered, to be our best selves, to be our uplifted selves, to be our upgraded selves, and not to, be put out to pasture because we're menopausal. So that's my goal today, is to help you guys be your best selves. All right, these are some of the common symptoms that people will deal with when they're going through menopausal situations. So if you would go over to the chat box and type in if you have any of these. I'll call them off and just type yes if you have these. So hot flashes, that's probably the most common thing that I hear. Do you have hot flashes? Just type yes. How about fatigue? And some of the things I'm going to say, people don't really realize that these are common menopause symptoms, but fatigue is. Weight gain, of course. Type yes if you've got weight gain and that's bothering you. Headaches, depression, urinary problems like UTIs or incontinence, insomnia, classic one, pain. Did you know pain can be related to menopause? I'm going to explain why all of these things happen, and so you'll understand what's going on with your body and how to address it. How about foggy brain? What about libido? Oh, is somebody, Jill Norton says she doesn't have sound. I've got some yeses coming in on the symptoms, but I'm wondering if other people are having troubles with the sound. Is anybody else having trouble with the sound? Kat, can you type in there for Jill to restart her thing? Okay, so I'm getting yeses. Type sound if you're having trouble with the sound. Okay. Jill, are you hearing now? Anyway, foggy brain, that's a common one. And again, you're going to understand that. How about libido, irritability, vaginal dryness? Those are none of those are fun, and probably most of those are the reason that you're here today. But I want you to take this a step further and think about why you're really here. Like, what's the why behind the why? For example, if you're finding yourself irritable and you can't sleep, how's that affecting your life? Is it having an effect on your relationships? Are you disappointed in yourself as a parent? Are you concerned that you might lose your job because you're not clear-headed? What is it that's affecting you? What's the underlying driving force for you to want to address menopausal symptoms? Maybe you want to prevent other diseases, which you're going to learn about here shortly. There's a lot of other things that can come right on the heels of menopause. So type in for me, if you don't want to say something personal, you can say in your chat to make it go just to the admin and not to everybody to see. I don't know if Jill's on or not. Trying to restart. Okay. All right. I'm not seeing anybody say what their why behind their why is, but maybe you can relate to some of those things that I said that menopause can be affecting in your life. All right, we'll move on. Oh, I need to go back to my slides. You have to forgive us if we are a little shaky on doing the webinar. This is our first webinar, so we've practiced, but we're still learning the loops here. So thanks for bearing with us. All right, it's menopause madness unless these three things, I promised three things that you needed to balance. Adrenals, you need your adrenals healthy, you need blood sugar balanced, and you need to have a happy, healthy gut. So we're going to go through that and you'll understand thoroughly why that is and how to address it. All right. One of the risk factors for menopause is that it can make you more susceptible to Alzheimer's. And so I want to make sure you stick around to the very end of the presentation because I'm going to give you an access to have a free test to determine if you're at risk for Alzheimer's. So let's run a little poll right now. And that poll is, have you had anybody in your family or, in your genetic pool that's had some type of dementia? So type yes if somebody's had that in their family, and type or click no if you have not.
You should see a poll to the right side of your screen.
Okay, we've got the majority saying no, a few of you saying yes. I have a feeling, now the yeses are taking the lead. It's like a horse race. Yeah, at the moment we've got 67% of you saying yes, and now it's 50-50. All right, anyway, it is a concern, and again, you're going to see as we move along here why that is. But be sure and stay on to the very end, because I'm going to give you an access to a test to determine if you're at risk. All right. This is me. I am a 1984 Olympian. I was ranked number 10 in the world and number 1 in the US in my event. And the reason I bring this up is partly because a lot of my patients don't know I'm an Olympian, but secondly, because people that are successful in life are the people that really take the bull by the horns, and that's 3% of the population in any one area. So, whether it's business or athletics or health, people that really have optimal and high functioning health, 3% of the population will go the extra mile, do what it takes to be their best selves. I know you guys are likely to be 3%ers because you're here. And I hope by the end of the presentation, you're going to really make a decision to be a 3%er. In terms of health, it takes a lot of fortitude to make decisions up front. And we run into things like, it costs too much money, or I don't have time, or, whatever other excuses we make for ourselves. But the thing is, if we don't make those choices now, the universe will make those choices for us later, and they'll take our time and they'll take our money. So my goal as a functional medicine doctor is to help people make choices to improve their health before major diseases set in. I earned my degree of chiropractic by attending 7 years of schooling, and you can see here that chiropractors have a very similar education to medical doctors. So contrary to popular belief, we're not just about back pain. In addition to my chiropractic education, I've spent hundreds of hours of study in endocrinology, immunology, and neurology. My specialty is actually brain health. So I wouldn't call myself a hormone expert. I'd call myself a brain expert. But in order to be a brain expert, you have to understand hormones, because hormones have receptor sites on the brain or in the brain. So I just wanted you to know that I do have a lot of education behind me and a lot of knowledge in these topics. Okay, so what is functional medicine? Well, functional medicine kind of fits between traditional medicine and holistic medicine. We do use lab tests and some traditional ways of looking at body function, but the whole idea is to look for underlying problems that could be causing disease or leading to disease. So we're searching out the subtle clues and imbalances and restoring that so that hopefully diseases don't manifest. And we're not just treating the symptoms. So here's the picture. The goal of functional medicine is to restore optimal function rather than treat disease. Medicine, our typical way of looking at health today, is to treat the tip of the iceberg. And unfortunately, that misses an awful lot of the picture. Functional medicine looks at that lower part of the iceberg, the part under the surface. So let me ask you, what would happen if you just cut off the tip of the iceberg? In other words, treat the symptoms or the disease only. What would happen? Maybe you can type that in the chat. I think you guys are delayed behind us just a tad, so I got to wait a second. I'll tell you what'll happen. If you cut off the tip of that iceberg, it's going to flip up or flip sideways, and you're going to have another tip up above, but you're going to still have most of the iceberg under the surface. So we like to get to the whole cause. Now, that doesn't mean you don't want to use medicine if you have a disease or a problem like that. In fact, you tell me, what do you want to do? Do you want to use, if you get a disease, do you think it's a good idea to use medicine traditionally only? Do you think it's a good idea to use functional medicine where you're looking at the underlying problem? Or do you think both is a good idea? I personally think both is a good idea. If you need medical care, go ahead and get it. But don't overlook the fact that there's all these underlying things that could be leading to problems as well. So that's functional medicine. All right, I need to click over here. There we go. All right, so now let's get into a little bit more of the nitty-gritty of menopause and what happens. So technically, perimenopause can last about 10 years for a woman. It can start really at age 35 or so and go all the way to age 60. Perimenopause just simply means that your hormones are changing. The average age of menopause is 51, and menopause technically means you have not had a period for over 12 months. So we're going to run another little poll just so I have a little understanding of everybody that's here. This poll, I want to know what stage you're in. Do you feel like you're perimenopausal? Are you menopausal? Maybe you don't know. Maybe you don't feel like you're in any of those. So let's go ahead and start up that poll. And let me see where you guys are, because it's going to help me understand how I should speak from here on out in the talk. I know I saw in the chat before people that were over it had been menopausal for some years. And I notice sometimes that people are still having a lot of symptoms, even though they are postmenopausal by quite a few years. Okay. So a few of you are saying your cycles have changed. Most of you are perimenopausal, so you're still having periods. And then the next largest group is those of you that have no periods and haven't had them for over 12 months. I myself sit in the clearly perimenopausal. I'll be 58 next week. And my last period was a few months ago. I feel like I'm about to start another period, like today. So I thought that was ironic. Anyway, okay, so mostly the perimenopausal and the postmenopausal group is what we're looking at. Alrighty, moving on. So here's what happens. When the hormones start changing in that perimenopausal phase, the first thing that happens is your progesterone declines. And so we end up in this relative estrogen dominance. So what happens then is your period lengths might change. So you might, if you've been a 28-day on the clock person, they might go to every 3 weeks, or they might be 3 weeks, one cycle, 5 weeks, the next cycle. Also, it's common for the cycles to become heavier in the perimenopausal phase. And sometimes people start noticing emotional changes, and that stresses are affecting them more. And this is where sleep issues can begin as well, because progesterone actually helps you to fall asleep. As the estrogen starts to decline, bigger problems start to appear. And in order to sail through menopause gracefully, we need to have healthy adrenals, because the adrenals back up for the body when the estrogen drops. And I'll show you that here in just a second. So we have to have healthy adrenals in order to get through this. Unhealthy adrenals equals hormone surges and an immune surge. And when I say hormones, I mean adrenal hormones as well as thyroid and the female hormones. Right, so here we have hormones and what happens. in the body. Cholesterol is how your body actually makes hormones. This whole pathway that you're seeing on the screen right now happens in the adrenal glands. So cholesterol turns to pregnenolone, and then pregnenolone differentiates into cortisol. You've probably heard of cortisol. That's the stress hormone. And it also differentiates into the sex hormones. When the adrenal glands are weak, we get this thing called pregnenolone steal, where all the pregnenolone goes down that left pathway towards cortisol, and it robs the pathway towards the sex hormones. So even for women who are pre-perimenopausal, in other words, they're in their, their full functioning years, they can have this happening, and that'll cause hormone imbalances. As we move toward menopause and the ovaries are producing less estrogen, this becomes a bigger and bigger problem. So it's the pregnenolone steal. That's why the adrenals are so important for the health of your everything, as you're going to see in just a moment. All right. So when the adrenals are weak, like I said, it's going to cause hormone surges, and the hormone surges cause an immune response. So it looks like this. The little guy on the left here is your adrenals, one of your adrenals, and that one's fatigued. The adrenals are the great balancer of the immune system. They keep the immune system in balance. And when they're weak, then the immune system goes out of balance. So I'm going to switch over here to a whiteboard. Okay, and it looks like that still shows the slide, but I think that's going to be okay. Maybe I'll stop. Hang on. There we go. Okay, now I think we have the whiteboard. All right, now I'm a science person, so that means I'm left-brained, which means I'm a terrible artist, so I'm sorry about that, but I think that this is going to be valuable for me to draw this. All right, so that's a brain, my best rendition of a brain. Here we have, like I said, adrenals are weak while inflammation is elevated. Well, when this happens, the body is sending out these little chemical messengers called cytokines, and those are inflammatory messengers. So those messengers go throughout the body, but in particular, they go to the brain. So you get all these messages of inflammation bombarding the brain. They go especially to this middle area right here called the limbic area. That's your emotional area. What do you think happens, or what does happen in your life when you're constantly being bombarded by something? Let's say it's your kids asking you questions over and over, or it's music that you don't like that's bombarding you. You start to have a short fuse, right? You start to become irritable. Well, that's what's happening here is this inflammation is bombarding the brain. It's not being balanced by your adrenals. And guess what? It's causing more stress. So the more stress means, all right, my weak adrenals are going to try and kick into gear here. So now we have this happening. Adrenals are high and inflammation is low. And the adrenals are kicking out cortisol. So cortisol goes to the frontal cortex, and it goes to the temporal lobe. Cortisol kills cells in the temporal lobe. Temporal lobe is where you have memory. How many of you have noticed your memory declining? Not so good, right? And the frontal cortex is where you think and where you make decisions and where you can plan things out. So this is the brain fog piece, and that's not working. That looks like a terrible mess, right? Well, that's exactly what happens in menopause. It's the adrenals and the inflammation doing this rocky up and down, and never finding a balance, constantly bombarding the brain like that. Okay, now we're going to switch back to the slideshow. Let's see, I'm going to turn off the whiteboard. Going back to the slideshow. All right, there we go. Okay. So it's that imbalance that is the problem. This is why you don't feel well. This is why hormone replacement isn't the only answer. Hormone replacement will help, but it's not going to get to this underlying source. And once you get through menopause, you still have this whole thing going on, because once it's unbalanced until it can find some balance. So this is what we do, is we work from the brain level, really, and determine where the inflammation and where the bombardments are coming from. I hope that's helpful. So your brain, it controls moods, right? Controls sleep. It controls your temperature. So the hot flashes. It controls digestion. It controls moods. It's a brain-based problem. So back to those tests that I talked about in the beginning, this test on the left is called the VCS test. And that tests for, that's something that we do in the office, but that's the one I'm going to give you the link for in just a minute. That tests for neuroinflammation. And then the meta-oxy test is a test that we do here in the office also, and it tests for cellular inflammation. And who wants to know if they have inflammation in their body? Every one of you should want to know that. And if it costs $1,000 to do that, you should be glad to spend that every penny, because it will tell you your future health. Inflammation has been linked with all of these diseases: cancer, cardiovascular disease, Alzheimer's, diabetes, arthritis, autoimmune disease, neurological, pulmonary. So earlier, remember when I said if you don't make a decision now, it can cost you later? Cancer, for example, costs on average $200,000 out of pocket, not just your insurance, but out of pocket. I have a patient right now who's going through cancer therapy, and he gets immune therapy of some sort. It costs $40,000 per injection. So it's crazy, crazy, crazy. And this is another part of my mission, is I want to change the healthcare paradigm. We need to start taking care of ourselves, and doctors who can find things before they're a problem need to be paid for that, and you need to be rewarded for taking action, rather than waiting until we get sick and we have to pay zillions of dollars for care, and we're living less empowered lives. So this is my mission. I hope that you'll join me on it, and I hope that you'll share it with your friends. But I'm not done with the presentation yet. All right, moving on. And just so you know, it's not just me that thinks that. This was an article that was in the New York Times a few years back, and they're talking about menopause, and it's linked to Alzheimer's, as I've said. Within the article, they say symptoms like night sweats, hot flashes, and depression originate not in the ovaries, but largely in the brain. So there you have it. Does this feel like you? Due to the influence of hormones, I could burst into tears or kill you in the next 5 minutes. I belong to a menopause support group on Facebook, and oh my gosh, it's scary to see the things that people are going through. I mean, this picture is almost minimalizing it. Women are having such anxiety, they can't deal with life, they can't deal with their children, they can't sleep, they can't work effectively. They're just, oh my gosh, it's awful. So I hope you guys aren't in that boat. But one of the other things that I mentioned that must be balanced is blood sugar. And that's because blood sugar is fuel to your cells, and it's also fuel to your brain. And as that adrenal imbalance and immune imbalance goes wonky, so does the blood sugar, and vice versa. Here's some of the symptoms of low blood sugar. People get headachy, sweaty, shaky, confused, dizzy, grumpy. Does any of that sound like menopause to you? Sure it does. Here's ways that you can balance blood sugar. A low carbohydrate diet is good, not necessarily no carbohydrates. So less carbohydrates, more protein, and more good fats. Don't let yourself get too hungry. Coffee and alcohol can make it worse, even though people like to think coffee is a health food. Eat first thing in the morning. So you don't want to let your cells go too long without fuel. Unless you're doing a ketogenic diet, and I'm not going to go into details of the ketogenic diet, but if you can get yourself to where you're in ketosis, then you can go to intermittent fasting and skipping breakfast and things like that. But until you can do that without being hungry, you're going to make things worse. Low inflammatory diet. So the most inflammatory foods are gluten, soy, corn, dairy, eggs, tomatoes, sugar, and alcohol. So you want to minimize those foods. You want to address toxins. Do everything you can to get the best night's sleep, and of course address cellular function. So those are some things that you can start implementing on your own right away to help balance blood sugar. And each one of those actually helps with the adrenals as well. The gut. The gut is ever so important. As one of my great teachers said, all disease begins in the gut. The gut is 80 to 90% of the immune system. So when we talked about that teeter-totter of the adrenals versus the immune system, oftentimes the immune system is getting triggered because of the gut. And that can be happening whether or not you have gut symptoms. So we have to address the gut. I really recommend doing some testing to find out just how well the gut's functioning, if you have the right bacteria, if you have the wrong bacteria, if you have parasites, if you have poor digestive enzymes, if you have chronic inflammation, things like that. It's really important to look at the gut function. And if the gut looks great, then we look other places for inflammation. So the gut, like I said, is 80% of the immune system. Here's some symptoms, but like I said, you don't have to have, or here's some things that cause gut imbalance. But like I said, you don't have to have symptoms necessarily. So food sensitivities and too much inflammatory food can inflame the gut. Parasites, bacteria, fungi certainly can. Those are pathogens. Liver function will inflame the gut. And liver function also can put you at greater risk for estrogen-related cancers. Toxins, of course, can mess with the gut. Enzymes, medications, bad microbiome, the weak adrenals, once again, bad fats, glyphosate, which is sprayed on our grains, and concussions, believe it or not, can lead to gut problems. So if you've had a concussion in the past, it may have messed with the gut, and that could be triggering inflammation. Leaky gut. If you have leaky gut from any of those things on the last slide, that really, really, really ramps up the inflammation. One of my specialties is helping people to reverse cognitive decline and dementia. These are the 6 things that we address in that. So inflammation is a number 1 cause of dementia. Glycotoxic, that means blood sugar imbalance. Trophic means adrenal and other hormone imbalances. Toxins, circulation, and trauma. Well, guess what? Those are the very same things that mess with menopause and make you feel bad during menopause. This is why there's a link between menopause and Alzheimer's or dementia. Women are twice as likely to get these diseases as men, and I believe it's because they go through challenging menopause years if it's not addressed appropriately. So here it is in simple form: adrenals, blood sugar, and inflammation. That's the 3 things, real simple. There are tests that we have available in the office. An ASI looks at the adrenal function. And then we like to look at blood tests because that tells us a whole lot. And the GI map is one that looks at the gut function very thoroughly. The most dangerous effect of all is the brain stress. In reality, all stress is brain stress. Now think about stress that you've had in your life. I mean, you know, what's some of the worst ones? Divorce, kids having trouble with drugs, challenging jobs, not enough money, moving a bunch of times, being exposed to toxins. These are all stresses that over time have weakened the adrenals. And that's why we get to this place when we hit menopause. Once the hormone surges stop, as I said, the inflammation may not. And that's a big concern. So you might get past the hot flashes, but you may not be past the inflammation. And here we have it again. It's really a brain issue. And that's what's different about us as we look at this whole big picture. We look at the underlying part of the big iceberg and address all of that. Oh, and what about our men? Men go through their own menopause. It's called andropause, and it may not be a shorter period of time or a distinct period of time like it is with us. It can happen slow. It's a slow decline of androgens, which are the male hormones. It can actually happen at any age. We see it even in younger men. It leads to brain decline, metabolic syndrome, and cancer concerns. Some of the symptoms that you may be seeing in men in your life is low motivation, low energy or depression, low enthusiasm, decreased strength, moody, irritable, or pessimistic. So they like to say, we're moody, irritable, and pessimistic, but what about them? Urinary problems, and gradually losing their sex drive or loss of morning erections. So they don't have to have all those, just like we don't have to have all the symptoms of menopause, but these are classic symptoms of andropause. And basically, we address it the same way as we do with the females. How do we restore? How do we get you back to balance? Well, number one, we want to look at the gut. I think I've made that point. Number two, we want to balance the blood sugar. Number three, we want to fix the adrenals. And it may not be in that order. For any one of you, it could be one of those things more than the other. Stress management is imperative. Chiropractic has been shown to be one of the light touch chiropractic we do in our office has been shown to be one of the greatest things to reduce stress stored in the nervous system. And that would be stress that's been stored in there over your entire lifetime, even starting at birth. So again, chiropractic is not just for back pain. Exercise makes a big difference. Of course, diet, lifestyle, and sleep are necessary. Supplements I'm going to talk about, but a couple of them that are really important are anti-inflammatories and antioxidants. And hormone replacement may be right for you, but for some people it is definitely not right. Here's a list of my favorite supplements. And Kat, right now you can put up the link to Thorne in the offers. So some of my favorite supplements, Metabalance and Estrovite, are two supplements that help to balance the estrogen surges. Phytozone or adaptocrine, so we have all these in the office, but the link that Kat's putting up, you can go directly to purchase Metabalance or Phytozone. So the Phytozone and adaptocrine are for adrenals. We have here in the office Colorado hemp, which is another name for CBD. The Thorne link also has a CBD. CBD has been great as a mood stabilizer and anti-anxiety. Some people, that's like their savior. It reduces the sympathetic overdrive. So sympathetic overdrive means that stress response. Your brain's getting bombarded over and over and over. The CBD can kind of help calm that bombardment down and the stress response from the bombardment. Glutathione is one of your most powerful antioxidants. Vitamin D helps balance the immune system. Turmeric is an anti-inflammatory. Tryptophan and serotonin, serotonin's a supplement we have here. Those are both great for moods. There's been, and for the hot flashes, there's a link between serotonin levels in the brain and your hot flashes. And omega oils, fish oils, essential fatty acids are also important. So those are great supplements. However, remember, they're kind of addressing the tip of the iceberg. They're not really getting to the bottom of the barrel to find the real problems. All right, I don't think I need to talk about that again. So wouldn't you want to know if you're at risk for Alzheimer's and if you're at risk for some of these other diseases? Here's the freebie I promised down there at the bottom, vcstest.com. The VCS test is an eye test that you can do online for free, and it shows if you have neuroinflammation. It'll only say positive or negative when you do the free version. If you pay, I think, $10 and put in my name as your doctor, then it will send me more details so we can understand more specifically what's causing the inflammation. Or if you come into the office for a complete evaluation, we do both those tests here in the office. An evaluation in the office costs $250. It covers looking at adrenals, looking at inflammatory factors, looking at how stress is accumulated in your body, determining the right way to approach that. However, the other gift that we would like to give you is another freebie, and that would be a complimentary consultation with Cynthia, the health coach. And you would get to have a 10-minute time with her to discuss your particular situation and determine if we can help you. And if we don't feel like we can help you, we'll give you a little bit of guidance and send you in the right direction so you can start improving your health today and for the long term. And so right at this moment, I'm going to turn it over to Cynthia, and she's going to say a few words.
I just wanted to talk with you a little bit about what my why behind the why is. You know, I've always known that I wanted to facilitate humans in being their best selves. I think it's based on compassion, and there is a little bit of a selfish thing there, because when I see someone who's in pain, it hurts me. You know, and so I want I want everyone to be their best selves, because our community, a healthy community, is fun to be around, right? We have content and productive and balanced people. And so that's been my goal my whole life, throughout all of my careers. Even when I was teaching adverbs and pronouns in public school, I still had my little tribe of kids and helped them and their families grow and be their best selves. So here we are at the wellness clinic, and as I'm personally going through this perimenopausal thing, it's sometimes alarming, actually, what's happening to my body. So I encourage you to give us a call. I've set up a schedule for those consults. If it doesn't work through that Calendly link, if those times don't work, I would happily do a phone consult anytime, unless I'm sleeping. But if you are having trouble in those times, just let us know. I think it's worth it. It's free. And we can just do a little assessment to see what your restoration strategies should be, and if our office is the right place, and then direct you together. We could decide what's best for you. I'm really excited about this, personally and professionally. So thank you, Dr. Maria.
Thank you, Cynthia. So I hope you understand that whole brain piece. The adrenals getting out of balance, which causes the immune system to go off, hits the brain with all these immune triggers. The limbic system gets on overdrive, and so there's no room to deal with stuff. We have this little area where you can deal with all the little stuff of daily life, and basically it's the cup runneth over. Little things trigger you. That same area has to do with sleep. Then we've got the adrenals that are hitting the frontal cortex, so it affects memory and thinking. Just that whole sort of cascade of events. We call it an immune windup. So I hope that we made that clear. I made that clear for you. Let's just take a moment now and think. Oh, there's Cynthia. Hi.
That's me. And I noticed that Kat has put up the Calendly link right there in your chat box. So that's where you'll be scheduling.
Yeah. However, just for a moment, I'd like you to close your eyes. And let's just think for a moment. If you could imagine yourself in 5 years, and imagine yourself as your best self. Imagine, who you want to be. Do you want to be up on the mountain skiing and having a great time with your grandkids or your kids? Do you want to be really feeling empowered in your career, if that's your passion? Do you want to be running on the beach? Do you want to be making some big difference in the environment? What is it? Who do you want to be in 5 years? And then let me ask you, can you be that if you don't have a high functioning brain? You have to have a high functioning brain to be your best self. So if you don't do anything, if we don't do anything to change the course of how things are looking, what's that going to look like? Could be kind of disappointing, right? So I hope you'll be a 3%er and click the link to sign up for a consultation with Cynthia. It's calendly.com/Dr. Maria. And that will take you, it's 4 clicks, I think. You click that link and it will take you to the page, and you can pick a time to talk with Cynthia. And we can do that by phone or in the office. I would recommend coming into the office if you're close. And she will direct you in down the right path so that you can achieve those 5-year dreams. All right.
Yes, let's do this.
Yes, let's go, girls. Yes. You're my
Come
tribe.
on now.
We got to be good. We got to, it's not okay for us women to be put out to pasture. We got to be. I just want to see empowered women in this age group. All right. So at this point, we're going to open things up to questions. And you can type your questions in the chat box.
Okay, our first question today is, how do you feel about hormone replacement therapy?
Well, like I said, some people are going to do great with hormone replacement therapy, but there is a bit of a concern because it can increase the risk for cancers. So if you were going to do hormone replacement therapy, I'd want to look at your genetics, and I would want to look at how your body is detoxing estrogen. Those would be tests that we would run. It definitely can help people, but it also can make people worse. I actually felt worse when I went on hormone replacement. I felt like I was premenstrual all the time. So yeah, I don't have an opinion that you shouldn't do them, but if you're going to do them, you want to be safe about it.
Okay, and what is the best supplement for hot flashes?
There's a couple supplements that, as I showed you, we have here in the office, or that you can get on Thorne. But basically, you want to be looking for things that have Dong Quai, black cohosh, genistein. All those are what we call estrogen modulators. So the hot flashes and some of the emotional stuff is, as estrogen rises, you get a hot flash. So a modulator means it's going to help with that balance thing. So those are what you want to look for in an estrogen type supplement.
Okay.
And we also want to be careful with treating the symptom. We want to get underlying. So as you do that, I encourage you to take a good look, maybe come in and talk with Dr. Maria and find out what's causing that, because it's maybe not just estrogen surge. It could be some other thing.
All right. And I encourage you to keep typing in your questions in the chat. And as they come in, I can address them and read them. Is there something you can do for anxiety?
Oh, yeah. Good question. So the CBD is great. On that Thorne site, you can get, it's called hemp on there as well. We have to be careful how we use that. Hemp, you can get CBD from hemp, and it doesn't have THC, and that's what makes it legal in our state and our country. There are other states you can get CBD that have THC with it, but the CBD is really great for the anxiety.
And we'll be doing a CBD webinar in April, so you could look for that if you're curious more, if you want to know more details about that. And there's also a lot of other anxiety ideas and treatments and even just breathing that can help anxiety.
Yeah, so, breathing, meditation. Another supplement that can be really helpful is L-theanine or some sort of GABA support. GABA is your calming neurotransmitter. And along the lines of our CBD webinar coming up, we also will be posting on Facebook. So be sure and like Dr. Maria Maricic, the Wellness Clinic, on Facebook, so you can be seeing those posts happening.
All right. Our next question is, how do I communicate with my partner about menopause?
Good
oh,
question.
Boy. That's a really good question. Number one, absolutely communicate with your partner, because they don't understand. They have no idea. In fact, I thought I understood as a physician, until I went into menopause myself, and now I understand a lot better. So, it's just really important that they do understand. I'd say, I need to share with you what's going on with me, and I need you to understand that this is really challenging, and share with them, and get some feedback.
It's an opportunity for transparency and practice in your intimacy with each other.
Yeah. I mean, it's, there's sexual issues, there's relationship issues, there's sleeping issues. My husband and I are not sleeping together right now because he snores and I'm a light sleeper, and so I can't sleep well with him. So we both felt bad about that. We felt like that was a sign our relationship wasn't good, but we've been talking about it, and actually, because it brings up conversation, maybe it's made our relationship stronger.
Yeah, good.
Yeah.
Awesome. Well, I don't see any other questions in the chat at the moment. So it looks like they've all been addressed. Thank you very much, Dr. Maria.
Okay, great. Alrighty, well, I hope you all enjoyed the webinar, and we'll see you soon.
And thank you, Kat, for your work with us today, being such a great little
Thank you, everyone.
girl. Thank you so much.
So on behalf of my entire team, thank you, and have a great day.
All right, thank you. Bye.